There are ways to minimize pain and discomfort after a hysterectomy surgery. I know that you may enter the surgery with a lot of questions and wondering what's going to happen afterward with your recovery, but being informed on what to expect and also how to ease any pain or discomfort and speed up that healing process. Any of this information is going to be very helpful to you, especially if it's not shared by your doctor. My name is Dr. Dawn Andalone. I'm a pelvic floor physical therapist, women's health physical therapist that has helped thousands of women recover from a hysterectomy surgery. And if this is you, if you're preparing for a surgery or you've had one and you're looking for information, we are going to cover this today, how to make you feel better and work on some self-care techniques and tips that are going to guide you in this process. I think it's important to note there's different types of hysterectomy surgeries. But if you haven't already had your surgery, make sure that you're consulting with more than one doctor. It's important to not just take advice when someone recommends a surgery or something invasive and just running and going with it without exploring all of your options. Make sure that this is absolutely necessary and also that you have discussed it with more than one doctor, more than one surgeon. Now, if you are going into your surgery, there are a lot of things that you can prepare for, and especially with your core and your pelvic floor muscles and learning what you need to do to prepare for it so you can heal better. But if you haven't done that and you've already had the surgery, don't worry, it's not too late. I'm going to talk you through some of the best tips that I have found from my clients that have been helpful. So number one is making sure that you are following medications, and whether that's over the counter, if you just have some slight discomfort, like taking some Tylenol or Advil, whatever the doctor advises you, or if you're given prescription pain pills, this might just go on for a few days to minimize your symptoms and make you feel better so you can actually sleep and rest a little bit better. Now, some people don't have much pain after the surgery and some people do. So it's important to note that everybody's going to be a little bit different with their recovery and their healing. The next tip is if you have an incision, whether you have an abdominal incision or you have portal sites that are healing from a laparoscopic surgery, you want to make sure that you keep those incision sites in comfortable, loose clothing. You're not putting anything too compressive against it. And you also are keeping that area clean and dry. You're not submerging yourself in a bathtub, hot tub, swimming pool until you've been cleared by the doctor. You want to make sure that's going to heal properly. Also, if you're seeing any signs of infection like redness, swelling, or oozing from any of the incision sites, you definitely want to go back to your doctor and get that checked out. You don't want to have something that's getting irritated and will prolong the healing too if something is infected. Something else that might be helpful is heat therapy. Now, putting a heating pad on your lower back or your lower abdominal area, or even around your legs, the back of your knees, anywhere that might be a little stiff, achy, or uncomfortable after your surgery while you're resting, that can be very helpful too. Now, a heating pad you don't want to keep on for longer than 15 to 20 minutes at a time, but you can alternate between taking it off and putting it back on through the day while you are resting. That can also ease some discomfort. Next tip is moving. You want to start getting some moving and activity, but listening to your body. The most important movement that you can start doing is walking, and walking on flat surface and just gradually increasing your endurance every day. Now, walking is going to promote blood flow, circulation. It's going to help you healing. But if you feel like you're getting any pain or discomfort or it's too much, just listen to your body and balance that out with the same amount of rest as being up and moving around. Not doing house chores, not doing anything strenuous, but just starting to do some walking so you get more of that blood flow and circulation promoting healing. There is also some helpful exercises like deep breathing exercises, some pelvic floor and core basic exercises that are beneficial, and some light stretches you can do. Not as strenuous as going and doing a yoga class, but something that is going to take you through a more therapeutic route of how to get your muscles to start activating again, and also help promote the healing. I have a perfect program for this. It teaches you what not to do during a hysterectomy recovery, but also what to do, what to be adding in, what types of exercises to be doing. So I'll link that below with my recovery program that's simple to follow and gives you step-by-step videos to start doing once you've been cleared by your doctor. Movement is medicine, and looking at more of the holistic route of paying attention to your movement, your resting, and also your nutrition is very helpful. Now, nutrition, it's hydrating your body. You're not having a lot of caffeine or diuretics, but you're adding in fluids that are healing, like warm soup, warm broth, some hot herbal tea, things like that that are going to keep the lymphatic system going, which is your system in your body that helps promote the healing and the inflammatory process and moves it along. Therefore, nutrition, adding in more like collagen sources of a smoothie with collagen protein or other protein sources also help for recovery of the tissue and can be very beneficial when you're paying close attention to your nutrition and really dialing in those healing and warm foods for recovery. The next, it goes alongside that, which is constipation, and making sure that you're controlling the fact that constipation is not an issue that can add to extra pain or discomfort during a bowel movement. So you want to make sure that you are adding in more fiber, pay attention to fiber on food labels, and eat some dried fruit or other things that may increase the fiber in your diet, which will prevent having constipation and will promote more of a softer bowel movement so you won't be uncomfortable when you're going to the bathroom. Now, I hope you found these tips very helpful and found that your recovery is actually going quite well. And for a lot of women, it does. This video isn't to scare anyone. This is to give you more tips to help you with the process and also guide you in the right direction, even if your doctor hasn't told you the step-by-step recovery solution to help heal your body, which is what I do as a pelvic floor physical therapist. So go back, watch this video again, make sure you're going through those tips, comment below, let me know what you learned and what you're going to be adding into your recovery. Some women, they recover faster than others, so you can't judge your recovery on someone else's experience, but you can be informed and you can learn the things that are going to help you get through this and have your best recovery. So thanks so much for watching. If you haven't subscribed, please do. I love to release new videos and teach you more about healing your body. Thanks so much for watching.